Hey guys, Dr. Shelly here. I want to share with you the 3 main reasons why people have stomach pain. So if you have stomach pain, either when you're eating or after you're eating, or you know anybody who is constantly saying, oh, my stomach hurts, then just hang in. It's going to only take about 5 minutes, and I'm going to explain to you the 3 most common reasons why somebody would say, my stomach hurts. Okay? So when you are talking to somebody and they're like, oh, my stomach hurts, or I'm bloated, or I have, acid reflux or something like that, it's not fun to deal with that or to have to help somebody dealing with that, because eating is such a big part of our culture. We all know this. So you want to be able to go out to eat. You want to have a meal with your family and not be in pain afterwards. I mean, eating and digesting is not supposed to be a painful process. So one of 3 reasons you can't have a pain-free meal, and I'm going to tell you how to fix it too, okay? So reason number 1, okay? If you have acid reflux, which is actually called GERD, if you're someone who's like, oh, I have heartburn, okay, that's GERD. Acid reflux is when the acid that's in your stomach comes up into your esophagus. So this is not normal, all right? The acid in your stomach is supposed to stay in your stomach, all right? And when it comes up into your esophagus, it burns, and it kind of feels like your heart is burning, where that name came from. The misconception is that your stomach is producing too much acid, but that's not the problem. The problem is that the acid is not staying in your stomach, because if the acid stayed in your stomach, it wouldn't burn. It's supposed to be in your stomach. So people go and they get antacids, which temporarily makes them feel better, but an antacid, decreases the amount of acid, but if there isn't too much acid, then it's not going to actually fix the problem. Some people, they go to a medical doctor and they say, oh, I have acid reflux, I have heartburn all the time, and then they prescribe them a proton pump inhibitor, which is a pretty strong drug that causes your stomach not to produce as much acid. But again, the problem is not that there's too much acid. The problem is that the sphincter between your stomach and your esophagus loses its tone. So it's not tight like this. So the acid can get up from your stomach into your esophagus. The sphincter kind of is open like that a little bit. So the acid seeps up, and then you have heartburn. So antacids, as I said, it's not going to be a permanent fix at all, because it's a sphincter problem. The proton pump inhibitors, for the same reason, are not going to fix that problem either. Just going to kind of cover up the symptom of it. And proton pump inhibitors they're really bad, and they're becoming more controversial, but they're really bad because they actually cause the parietal cells in your stomach, which produce the acid, to stop working, okay? And when those parietal cells stop working, you're going to have decreased acid in your stomach, but those parietal cells also make intrinsic factor, and you need intrinsic factor to absorb B12, vitamin B12. And without B12, you get what's called pernicious anemia. You also can get tremors, your nervous system gets all messed up, you get almost like a Parkinson's type symptom from not having enough B12. So proton pump inhibitors, they might make your stomach feel better temporarily if you have heartburn, but you're gonna end up with anemia and all these neurological problems. So not worth it, okay? The second reason why somebody might have stomach pain after a meal, or at any point in time, is because they have what's called a hiatal hernia. And a hiatal hernia is when your stomach, the actual stomach, kind of pops through your diaphragm. So you have your stomach, your diaphragm, and then your esophagus that comes up like this. There's a little opening in your diaphragm, okay, between your stomach and your esophagus, okay? And if the stomach pokes up through that opening like this, it's called a hiatal hernia. And there's different degrees of this. This could be just kind of uncomfortable and it can go away on its own, or it could be excruciating and you don't even want to breathe, okay? You might think you're dying, go to the hospital, think you're having a heart attack, but really what happened is that your stomach herniated up through your diaphragm and it's causing pain. So what's really interesting about hiatal hernias is that if you go to a medical doctor and you say, oh my gosh, I have this terrible hiatal hernia, they do imaging to find out that's exactly what it is, they will do surgery to basically get the stomach to go back down underneath your diaphragm. Surgery. They're going to cut you open to do that, all right? I had the most awesome mentor in the whole world who taught me how to adjust a hiatal hernia, to do a chiropractic adjustment to actually get the stomach to go back down underneath the diaphragm. It is super painful. It's not a comfortable procedure. It's not a comfortable adjustment at all, but I've never had it not work for somebody, and it's my go-to. I mean, even if you try that first before getting surgery and it doesn't work, at least you tried everything natural before you went and got cut open. So hiatal hernias can be fixed without surgery and medications, which is the good news, okay? Another thing that works for hiatal hernias, if you don't have a chiropractor who knows how to do that adjustment, and I've had this work for a couple patients, is you get a trampoline and you jump up and down on the trampoline. No matter how much it hurts your stomach, if you're having a hiatal hernia, you probably don't want to move around too much, but jumping up and down on a trampoline, it actually, like, this is your stomach coming up, it actually pushes your stomach back down underneath your diaphragm. It's almost too good to be true, right? And you get to jump on a trampoline, so you get to have fun in the process. So those are two ways that you can remedy a hiatal hernia without surgery. The third reason that you might have stomach pain is actually not a stomach problem at all. It's a gallbladder issue. So usually when you eat food and you get gassy, you kind of get bloated, or you're burping a lot, you're gassy the other direction as well, it's actually a gallbladder issue. So if you have gallbladder stones, or if your gallbladder is just kind of sluggish, the bile is not able to get into your digestive system, into your stomach, and help digest foods, specifically fatty foods. So if you're somebody who has a fatty meal, okay, with a lot of oils or just a high fat meal, and you start burping a lot, sometimes actually when people take fish oils, if they start burping a lot, one of the reasons may be that their gallbladder is not able to help them digest those fats properly. So if you think that this is you and it might be a gallbladder issue, there are things that you can do at home to kind of flush your gallbladder out. And the disclaimer before I share this is that if you have gallstones, and if you have bad gallstones, and I mean, there's different sizes, there's different types, but this could be a really, really painful thing for you to do. I'm not going to share specifics here, but if you guys want specifics of how you do a gallbladder flush with things that you would have in your kitchen, just reach out to me. I'll give you the specifics of it. But it basically involves olive oil and some kind of soda and salt, okay? And what those ingredients do, if taken properly, actually, like, here's your gallbladder, like, squeezes your gallbladder and flushes it out, and any stones that are in there will be flushed out. And again, this could be so painful if you do have gallbladder stones, but I've had patients that were lined up to get surgery to have their gallbladder removed, and I'm like, look, just try this first, and if it doesn't work, you're getting your gallbladder removed anyway. But if it works, you get to keep your gallbladder. So they did it, they cried, they screamed, they said they hated me, and then their gallbladder was 100% A-okay. They didn't need the surgery, they still have their gallbladder, and what's even cooler, besides the fact that they have their gallbladder, is that now they can eat fatty foods and not burp and get bloated and all of that. So it works, okay? The other thing you could do to help your gallbladder if you don't want to do a gallbladder flush is you can take a few different supplements that help with gallbladder support. My two favorite are from Standard Process, of course. One of them is called Colocol, and the other one is AF Beta Food. And they have certain nutrients in there, and they have bile salts, actually, to kind of just help your gallbladder do its job so it can heal. So, again, the three most common reasons why people have stomach pain are acid reflux, a hiatal hernia, or gallbladder stones, or just a sluggish gallbladder. I really hope that this helps you guys to understand that it's not just that you ate something and now your stomach hurts and now you need a medication or a surgery. Usually, the thing that your body needs so that you're not in pain is as simple as doing a few things to increase the acid in your stomach so it can digest food, or maybe you need a hiatal hernia adjustment to get your stomach to go to the right place so that it's not poking through your diaphragm, or maybe you just need to take some supplements to support your gallbladder. So anyway, I hope that this helps you guys. So the next time you're at a restaurant or eating with your family and someone's like, oh, my stomach hurts, just reference this video and be like, okay, it's one of three things, okay? It's, 1, 2, or 3. And then you'll know better what you need to do to help that person with their stomach pain. So if you guys have questions, as always, please put them in the comments below. If you want more information about the gallbladder flush, reach out to me. Or if you're somebody who's just like constantly having stomach issues, let me know, because either I can help you or I can refer you to somebody who can help you with a few things that might be more complicated than that. And as always, eat as healthy as you can, because that's step 1. All right, guys, talk to you soon.